Here we have CT scan on 20-year-old male with history of head injury. So what I want to show here is this abnormality situated in the midline. So how to describe this abnormality? So if I want to describe purely in radiological terms, there is a well-defined rectangular shaped homogeneous low attenuation area in the midline between the two lateral ventricles, similar to the attenuation of the CSF, limited to the supratentorial region. The lateral ventricles appear unremarkable, the third ventricle appears normal, and the fourth ventricle is not dilated. So this is how I would describe the radiological abnormality, but this is very clear that this radiological abnormality is likely to represent a normal variation. So what are the common normal variations of CSF attenuation in the midline? So there are mainly three. So one is persistent cavum septum pellucidum, the second one is cavum vergae, and the third one is cavum interpositum veli. So what is this among the three? So if the CSF attenuation area is situated anteriorly to the anterior fornix, although we can't see the anterior fornix very clearly on CT scan, if the low attenuation area is situated only anterior to the adjacent to the frontal horns of the lateral ventricle, then it is persistent cavum septum pellucidum. But if it extends posteriorly, as in this case, up to the level of the posterior aspect of the corpus callosum, then it is called cavum vergae. It is also called persistent cavum septum pellucidum hyphen cavum vergae. If the cystic lesion is situated entirely posteriorly, then it is cavum interpositum veli. So here is a case of cavum vergae, which is a normal variation, usually of no clinical significance.